Hello everyone, my name is Kristen Funk and I'll be talking to you about staffing and scheduling. So we are all nurses, or if you're a nurse and you're working, then you know that staffing and scheduling is very important. It is an important role of the nurse manager as adequate staffing and can lead to decreased patient mortality. It can lead to increased nurse retention, and it is critical to providing the superb patient care that is needed. So there's a lot of important things with staffing and scheduling. I did find this quote in a nursing article that just said, "We rely on these systems to improve our ability to assure the right resources are assigned to the right situations that result in the best possible quality, safety, and financial outcomes." So to move on about staffing, the goal of staffing is to provide the appropriate numbers and mix of nursing staff to match actual or projected patient care needs and to provide effective and efficient nursing care. And that's as noted in the text. But to determine the number of staff that is needed, the managers need to examine the workload of the patients for their designated unit. So the Joint Commission and the American Nurses Association do say what they require for staffing, and the Joint Commission just says that they require that the right number of competent staff be provided to meet patients' needs based on organization selected criteria. The American Nurses Association actually have a set of requirements that they have for staffing systems that include to be created with input from direct care registered nurses, be based on the number of patients and patient acuity level with consideration of patient admissions, discharges, and transfers on each unit or on each shift, reflect the level of preparation and experience of those providing care, reflect staffing levels recommended by specialty organizations, and finally, to provide that a registered nurse is not forced to work on a unit without having been established to that unit. So just another quote that I found in an article, that unattractive schedules, poor practice environments, and high workloads are identified as important factors leading to discontentment and a high nursing turnover. So staffing is very important in order to keep the nurses that you have, and when you're adequately staffed, it can just really make a difference in the work environment. So there's a couple different systems that are used to determine the amount of staff needed. The first one is the patient classification system, and this can sometimes be referred as the patient acuity system, but it's saying that the patient needs is what determines the workload requirement. So every shift, mid-shift, you would check you would analyze the floor and see what the patient's needs are, and then see if the next staff has adequate staffing. The next shift has adequate staffing. There are some variables in this, as if nurses call off sick, if nurses are set to work with patients that have that have more complications than what their skill set will allow them to work with. Like, those things have to be worked out. But that is an option for a system. The Picard and Warner would rather have a demand management system, and they would say that it should be not just the shift before, but a couple days before, to establish the staffing that way. But no matter which one you choose, you still need to have nursing care hours established and determined, and that can be like the patient workload trends are analyzed each day of the week, or each hour if you're in a critical care unit, or for a specific patient diagnosis to determine the staffing needs, and that would be the nursing care hours. So you take the number of patients and then the number of actual nursing care hours needed based on their acuity, and then determine the nursing hours per patient per day, the NHPPD, that are required. So this is calculated by dividing the total nursing care hours by the total census, and this is all spelled out on page 219 in the text because it is kind of hard to verbally teach this, but it is spelled out there in the text. So medical surgical units would not require as many hours as, say, a burn unit, because those patients would require more staffing, more hours. The full-time equivalent, which is the FTE, is what determines defines positions. So I work 1.0, which is 40 hours a week for 52 weeks, and every other week I work 80 hours. That's 1.0. So this can be combined with multiple staff. So if someone's working 0.5 and someone else is working 0.5, that'd be 20 hours a week for each of them. So there are different methods to determine the FTEs that are required. These are spelled out on page 219 and 220. I would encourage you to look over them because they are also very hard to verbally teach over a PowerPoint, but I would suggest that you look at page 219 and 220 just to further look into how the FTEs can be determined. But one person that works full-time usually would work 80 hours, which is 10 8-hour shifts in a 2-week period. So then to do one full shift, you would actually need 1.4 FTEs because one person would work 10 8-hour shifts and then another person would work 4 8-hour shifts. So to fill up the full week, you need 33 shifts, which would be 4.2 FTEs, and that would be the same, even with 12-hour shifts, you still need 4.2 FTEs, and that is spelled out for you further on page 220 in the text. There is staffing mix that can be done, so not just registered nurses, but also licensed practical nurses and unlicensed assistive personnel can all work together on the unit to get the work done of hygiene care, feeding, transferring patients, turning patients. That would be more the unlicensed assistive personnel, where the RN would be doing the frequent assessments, patient education, and discharge planning. So if you have more RNs, then you have more flexibility because you have people that can do the work that requires the registered nurse to do it. Now, to distribute the staff, there is a variety of staffing that's needed from unit to unit, from time of day, morning versus afternoon versus evening versus weekend versus weekday. But it is important to have your staff distributed as needed. So, for example, like on a surgical unit, that'll be busier Monday through Friday, even busier earlier in the week than the end of the week. And then over the weekend, it wouldn't be as busy because patients would have gone home, especially if it's same-day surgeries when they leave. But then, because surgical patients would have a shorter length of stay. Medical patients, however, they don't fluctuate as much because they stay longer, new people come in, so it all depends on the unit. However, the units that are not as predictable, such as the labor and delivery and emergency room, they would have to use something called block staffing because they're not able to fully understand what their staffing needs to look like until it's that time. So block staffing is a set staff mix for every shift, but then there's also may need to have additional staff over the peak workload hours. So in the ER, that'd be from 6 to 10 p.m. in the evening after the doctor's offices has closed, or from 12 to 3 in the morning when alcohol-related injuries take place. But there needs to be continual access to the data reflecting when the peak workload times are in order to stay adequately staffed over that time. So to move on to scheduling, scheduling has become flexible and creative because of staffing shortages. However, this quote that I found really helped kind of solidify scheduling because interventions to address flexible scheduling may be difficult to implement due to staffing shortages. So even though a practice or an office or a hospital would want to accommodate flexible scheduling, it can be difficult just because of staffing shortages. However, they still make an attempt to allow that to take place. So there are a lot of flexible schedules. 4, 6, 8, 10, 12-hour shifts are taking place. Some people are working 6 consecutive 12-hour shifts in a row and then having 13 days off. So it all depends. But it does create Some disadvantages and advantages, because sometimes it may feel like the nurse is not actually working full-time if they're there 6 days and then gone 13 days. Sometimes the split shifts also disrupt the continuity of care for the patients. It can also be difficult for the nurse manager to communicate with their staff if not everyone is there all the time, if they're off for 13 days. However, there are advantages because it meets the patient needs over the peak workload times. It improves the staff satisfaction. They're maximizing their nursing availability usage. Different scheduling. There's self-scheduling, self-staffing. That means that it allows the staff to create and manage their own schedule. They would have to use backup staffing if needed, if they aren't able to schedule to do if they are short-staffed in the end. But the manager still needs to oversee the schedule, but the nurses and the staff are able to actually schedule themselves. There's shared scheduling, which allows 2 people to work 6.5 hours to fulfill a 12-hour shift, so that allows more variability. There's open shift management when the schedule is posted online and people can fill in where it's needed, which allows people that work all over the hospital to schedule, which gives that flexibility. Then there's also weekend staffing, where the weekend staff are no longer allowed to have short staff. They still have to be adequately staffed, but there is a bailer plan, which allows someone to just work 12-hour shifts over the weekend, but still get compensated for a full week of work. Now there's automated scheduling, which is, there's automated scheduling where it's automatically done and the staffing fits, like they put in the patient information, the nurse's information, and then the hospital information, and it automatically places people. So this allows the nurse to spend more time with patients who need it, and then the data is just continually displayed on a dashboard to allow for frequent updates. There is supplemental staff in the hospital where additional staff is needed due to people being short-staffed, so they can pull from PRN nurses, part-time nurses, internal floats, or external or outside agencies. So with internal pools, that does allow for the hospital to have a lower cost. The people are familiar with the organizations, and they're centralized, which would be like a whole pool where anyone can be pulled from and go to any floor, or decentralized where it's just the nurses work with one manager and are only ever pulled to that area. There's also external pools, which the nurse obviously must be oriented to the floor, they must have a valid license, and they need to have, that does compromise continuity of care. So that's an overview of the staffing. I do have a couple images here that I wanted to show you just kind of as some lighthearted stuff, but it is really hard when you're working short-staffed. And this comic over here, I was going to ask how working with a severely limited staff was, but I think I can already guess as the nurse wife is coming home from work. But I have experienced this in my work. I work in an office, so just as these memes show, the decreased funding causes decreased staff. The decreased staff causes increased nurse to patient ratio. Increased ratio causes more medical errors and nurse burnout, which will then lead to patients' death and nurses quitting. But I have experienced this myself in nursing because I work in an office where we are often short-staffed, and it causes for more stress at work. We're not able to get holiday time as we would like because we're only allowed one nurse off at a time just due to being short-staffed. And my nurse manager does still write our schedule on a paper, which is different than what was mentioned in this chapter as well, because the schedule should always be available online to everyone at all times. So there just are some things that could be improved, but obviously there's always things that could be improved. But I just wanted to kind of bring in some personal information with staffing and scheduling, because it can be hard to work in an office that is short-staffed, but then on days that you are fully staffed, it makes a huge difference. So here are my resources, and I hope you enjoyed the presentation. Thank you.